Welcome to this explainer. Today we're diving straight into a heavy but absolutely critical topic, the reality of fentanyl detox, and specifically why medical supervision during this process isn't just, a nice-to-have option, it is literally a life-saving necessity. If you or maybe someone you love are navigating this right now, understanding the science and the strategy behind supervised detox could quite literally save a life. So let's get right into it.
Okay, I want to start with a truly staggering fact. Fentanyl is 50 to 100 times stronger than morphine. Let that sink in for just a second. 50 to 100 times. That immense potency is exactly why rapid dependence happens so fast, and why the withdrawal process is just completely different from other opioids. A lot of the time, because illicit fentanyl is so unbelievably powerful, people don't even realize the sheer strength of what they're actually using, and that sets the stage for some really dangerous, unpredictable withdrawal patterns.
So, here is our roadmap for today. We'll be covering the fentanyl difference, the reality of withdrawal, the dangers of going alone, the medical arsenal, beyond the physical symptoms, and finally, building long-term recovery.
Starting off with Section 1, the fentanyl difference, a uniquely potent threat.
Now, fentanyl is a synthetic opioid, and it has this really unique mechanical quirk in the human body. Think of it kind of like water hitting a sponge. The drug builds up in your body tissues incredibly quickly, but it wrings out or leaves your system so slowly. It's this exact dynamic that creates an agonizingly prolonged withdrawal pattern. Because the drug just lingers in the tissues, the symptoms become wildly unpredictable. And honestly, this drawn-out discomfort is exactly what drives early relapse when people try to get clean without any help.
Moving right along to Section 2, the reality of withdrawal, the physical and mental timeline.
Look, getting through this process requires serious endurance. The onset of symptoms kicks off within just 12 to 24 hours after the last use. From there, it escalates, hitting its absolute peak around days 3 to 5. For short-acting fentanyl, this acute withdrawal period lasts a full 1 to 2 weeks, and for extended-release versions, it's even longer. It's this invisible psychological distress during these prolonged peaks that usually breaks a person's resolve. I mean, it is a marathon, definitely not a sprint.
And while fentanyl withdrawal isn't usually directly life-threatening, say in the way severe alcohol detox can be, the physical toll is just brutal. We're talking severe body aches, heavy sweating, nausea, and a rapid heart rate. But that is combined with crushing psychological symptoms, severe anxiety, intense insomnia, and cravings that are just off the charts. That mental distress is often the primary driver of a relapse, making attempting this whole process completely alone nearly impossible.
Which brings us to Section 3. Dangers of going alone. Why at-home detox fails.
The difference between trying to do this unsupervised versus supervised is literally night and day. On your own, you're looking at a massive risk of relapse. And remember, relapsing after a brief period of detox often leads to overdose because your tolerance has completely dropped. Going alone also means risking severe dehydration, terrifying drops in blood pressure, cardiac arrhythmias, and totally untreated psychological crises. On the flip side, supervised detox replaces all those immediate dangers with stabilized vitals, medication-assisted comfort, trauma support right there in the moment, and round-the-clock cardiac monitoring.
Let's look at Section 4, the medical arsenal, how clinicians actually fight back.
Okay, let's demystify some of this medical jargon for a second. You've probably heard the term partial opioid agonist. This is a medication like buprenorphine that binds to the opioid receptors in the brain, but it produces what clinicians call a ceiling effect. This is basically a brilliant medical workaround. It provides immense relief from the withdrawal and stops cravings dead in their tracks, but it greatly reduces the risk of an overdose and doesn't produce that dangerous high. It just simply allows your brain chemistry to stabilize so you can actually function and, begin to heal.
Clinical teams use a highly tailored medical arsenal to safely manage physical dependence. Alongside buprenorphine, clinicians might turn to methadone. That's a full agonist with a super long half-life that can prevent withdrawal symptoms for a solid 24 to 36 hours. Then you have support medications like clonidine, which zeroes in on those severe body aches and that crushing anxiety. This is not some one-size-fits-all approach, guys. It's a customized strategy designed to prevent the intense suffering that almost always triggers a relapse.
On to Section 5, beyond the physical symptoms. Healing the mind.
So, a truly comprehensive medical detox has to include behavioral therapies right from day one. Day one. Medications manage the physical side, sure, but interventions like individual counseling, group therapy to break that terrible isolation, cognitive behavioral therapy, and trauma-informed care, those tackle the psychological drivers. You absolutely have to address the underlying unprocessed trauma, the depression and the anxiety that drove the substance use in the very first place. And like I said, you have to start it immediately, not weeks down the line.
And honestly, the people delivering this care, it matters. Just look at the transparent clinical model at iRely Recovery. Their guiding principles literally, our entire treatment team is in recovery. Programs like this leverage a clinical team featuring a UCLA addiction psychiatrist, licensed nurses, and a CEO with 21 years of continuous personal recovery under his belt. The compassionate care you get there isn't just pulled from a medical textbook. It is deeply rooted in actual, hard-earned lived experience. They understand the cravings and the fear because, well, they've actually been there themselves.
Finally, Section 6, Building Long-Term Recovery, the Continuum of Care. Detox is really just the starting line. Step 1 is stabilizing the body. But real, long-term success? That requires transitioning seamlessly into Step 2, which is structured residential care. We're talking 28 to 90 days of deep trauma work and vital skill building. And then comes Step 3, dedicated aftercare. This uses motivational interviewing and ongoing somatic therapy to keep you reconnected with your body and confident in your sustained recovery. It's that smooth flow from one step to the next that creates lasting, genuine change.
Which brings us to our final thought for this explainer. Reaching out for comprehensive medical monitoring, including rapid, same-day admission where the detox begins right away, that is not a sign of weakness. It is a critical, highly intelligent medical necessity. So the only question left to ask yourself today is this: are you or the loved one you are researching this for ready to stop fighting alone and make that life-saving choice? The medical tools and the compassionate, experienced teams are out there waiting. Thank you so much for joining me. And remember, reaching out for help is absolutely the strongest move you can make.